on time. Thank you, Chair.
Yep. Thank you. Thank you for your questions. And now I'd like to recognize the representative from Alabama, Representative Sewell, for 5 minutes for questioning.
Thank you so much. I want to thank all of our witnesses for testifying today. Today I speak on behalf of 164,000 Social Security beneficiaries that I represent in Alabama. To say that I'm upset with my Republican colleagues and the Trump administration's cuts to Social Security is really an understatement. President Trump proposed more than $70 billion in cuts to Social Security and SSI disability in his budget. A budget is a reflection of one's values. You fund that which you value. And frankly, it really disheartening me that so many of my vulnerable seniors and those that are disabled have less services because of this administration. Doge/field offices and phone services. I believe that it shows a lack of respect for those who are more vulnerable in our society. In so many ways, it's as if my colleagues are turning their back on millions of Americans. This was evident with the passage of the big, ugly bill, law, in July, with Medicaid cuts to over 17 million Americans, many of whom are dependent upon a monthly Social Security check. This administration has shown a blatant disrespect and contempt for both the individuals and families who have rightfully earned these Social Security benefits. As ranking member of the Ways and Means Oversight Subcommittee, I have a duty to inquire and advocate on behalf of my constituents with the implementation of this unorthodox changes that are occurring at Social Security. It literally breaks my heart. I've had constituents who waited on the phone to speak to someone 2 hours, only to have someone say hello and hang up. We are witnessing in real time the marginalization of Social Security beneficiaries with disability claims. For those who live in rural America, this is even more evident with the barriers that have been put in place by this administration. Over the August recess, I had the opportunity to meet with representatives from many of the hospitals in my district, especially the rural communities. They all had one message in common. They reiterated the potential scale back of services and the distinct possibility of closure of hospitals because of the deep cuts in the big ugly bill. My staff in Alabama has been assisting one constituent in my district that resides in a rural community undergoing multiple medical examination by physicians since last October to complete their Social Security claim. Aside from the absurdity that it's taken more than a year for this individual to complete the necessary medical evaluations to close this case, this individual currently must travel over 30 miles in each direction to see a physician. This would be a strenuous task for anyone, let alone someone with a disability. Ms. Groner, if health providers are forced to close their doors because of this big ugly bill, what impact will this have on constituents like mine who have a disability, who live in rural America, who lack transportation, and who have basic needs?
They're going to get sicker. They're not going to be able to access the health care that they need. We work with advocates who try to help seniors and people with disabilities, and Medicaid is really vital. And so for 17 million people to lose access to health care means that they are not going to be able to have that level of care that they need, and they are not going to be well. And I don't think that in that situation we can expect that anyone would be able to work even if they wanted to.
Isn't it true that people with disabilities who return to work sometimes are more susceptible to getting sicker and having to stop work?
I think that that's a fear that they have because you don't know what's going to happen when you try to work. And you may have periods where you are able to work, and you may have periods where your health is suffering and you are impaired and you need to access your health care. You need to take time off. You need to know that your benefits are still there. And I think that goes to the issue of the risk and the reward and not wanting to lose the health care that you need so that you can continue to work if that's what you want to do.
Absolutely. 17 million people over the next 10 years could lose their health insurance. And it's frightening that we are still debating whether or not to extend the Affordable Care Act subsidies that allow so many people to be able to afford their health care. With that, I will yield back the balance of my time.